Yeah, so my name is Brian Ward and my organisation is the European Respiratory Society. So the one that we're most interested in, because we deal with lung diseases, is lung cancer. Lung cancer is the biggest cause of death in the EU from cancers. And what we're discussing today is how do we effectively implement lung cancer screening. First, I'd like to commend the work of the European Parliament, European Commission, to have lung cancer screening recommendations in place. And we need now to have further funding to help member states implement screening. I think we have a project, it's the strengthening of lung cancer screening, it's called SOLACE. And some of the findings from SOLACE are very interesting that can be taken to, there's 15 countries in there. Some of those recommendations can be taken to the rest of the EU. What we're finding is very interesting ways of how to reach vulnerable populations, disadvantaged populations, what the theme of today's event is about as well. And some of these recommendations, such as, for example, having mobile units go around into rural populations to encourage people to have screening, that's something that can be taken forward in the future. Yeah, I mentioned the mobile unit as one. Another way you can do it, and we have it in this SOLACE project, is, for example, when women are having routine breast cancer screening, if they're at high risk for lung cancer, they have a joint invitation. So they have an invitation to have a breast check. They also have a lung health check at the same time. That's one way to reach a population. Another is training local communities, having mediation, having translation for minority groups, so you can get into these hard to reach populations.